Hello everybody, my name is Jyothi and welcome back to Green Table Talk. So today's topic is about pain. So this is my teacher and mentor, Chris Watts, and I think the reason why I got really passionate about your work is because I went through a lot of pain myself physically 5 years ago, and to the point where I had to deal with pain 24/7. So I basically had a QL issue. It was hiked up and that pain was shooting up my head and I couldn't really focus. I couldn't really work. I could only teach at most 2 to 3 lessons a day because I had to process that pain and I felt really depressed. I felt really down. And so because of that, I started studying pain and I started seeing a lot of doctors, physical therapists, physiotherapists, chiropractors, you name it, I've seen them all. So from your perspective, what is pain?
Well, pain is definitely a kind of compression issue. If there was no nervous system, there would be no pain. So pain is always a transmission through the nervous system, back to the brain, through the central nervous system, back to the tissue again. And it's a cycle, and you need to learn how to break that cycle. And there's many ways to switch off the pain cycle, as we found out in manual therapy. But we always start by looking at the body mechanics, which is the body structure, trying to get the distribution of the weight of your body even, left to right, front to back, so that you don't have more pressure or more compression on one side of the body where usually that pain is compared to the other side. So a lot of this has to do with pressure, which is really what compression is. So once we've looked at the mechanics and we can figure out and we've made you acutely aware of how you're carrying yourself, sometimes you need an outsider to look in, and that's a very important factor, because when you look in a mirror, it's very rare to see those, let's say, faulty movement patterns or those postural dysfunctions or asymmetries. It's hard to see that. And then basically I would then look for the muscle imbalances that always come about as a result of those mechanical and structural misalignments. So the muscle imbalances are kind of an obvious way to see how you've been using muscles effectively, efficiently, what's short, what's tight, what needs lengthening, and what needs stabilizing to hold you back in that new position that we're trying to drive you into. And then, of course, certain muscles that have been underused become totally deficient. So the third part is the deficiency, where they've forgotten what to do. They almost have a kind of amnesia associated with them. And then we need to make you acutely aware of where that is and how to turn those reflexes back on. So that's really how I would interpret pain, as a kind of compression problem, mostly through mechanical dysfunction.
Is pain good or bad?
That's a good question. I think pain is a very important device to warn us that something is wrong. I think if you don't have pain, then you will not be able to really understand where those pressures are or where those dysfunctions are, because they can actually cause wear and tear and inflammatory responses. All pain comes from inflammation. So inflammation is the source, if you like, of understanding how we can slowly but surely remove that pain.
Well, in our world, in the yoga world, we say that pain is actually an emotional response telling you something is imbalanced and that we must address it as soon as possible, because the longer we let it linger, the more it becomes our fabric. And it's the harder it is to get rid of it. Now, if someone comes to see you and there are those that have pain for more than 3 months, we call that chronic pain. Right? How would you help these people with chronic pain versus people with a more acute kind of pain?
Yeah, once it gets kind of entrenched in the system, then your body becomes kind of used to the compensation. Of course, the body is very good at compensating, which means some muscles are overworking and some muscles are underworking. And we need to be able to, again, address those compensatory patterns. So you have to firstly, through movement assessments and also range of motion assessments, figure out what you can and can't do, what makes the pain more acute. Is it extension? Is it flexion? Is it lateral flexion? What turns on the pain more acutely? So that would be something that we could figure out. And then we can do actual hands-on testing to test the soft tissue around the area of pain. Like you said, you had quadratus lumborum issues, which hike the hips up. And then you can find where those trigger points are and those tender points are, and slowly but surely release them. That can release the entire structure to a point where you can start moving without pain.
Right. So I was reading on your website, you wrote an article about how the psoas is related to survival and is a fight and flight kind of response. So I'm asking this because for those people who are anxious, highly anxious and staying at home, I presume if some of us are fearful of the future, so to speak, in fight or flight mode, survival mode, I presume that the psoas would react. You say it's one of those emotional muscles?
Yes, it is.
Can you elaborate on that, please?
Well, yes, I do think it's a very strong emotional muscle. We know that the vagus nerve, which is the second longest nerve in the body, it emanates out of C2 and it passes into the diaphragm. It's very much a breathing, and also they call it the relaxation nerve. It passes straight into the diaphragm. So we know that there's a diaphragmatic link with the psoas because there are two pieces of connective tissue called the crura that come from the diaphragm directly into the psoas. So locomotion and breathing are indelibly linked through the psoas. And when people are spending an inordinate amount of time sitting or lying around, the psoas becomes chronically shortened. But when you're in that fight or flight particular state of being, the muscles go into a contracted state. So does all of the arterial systems, venous systems, lymphatic systems. All of the systems that we have are super highly contracted on the back of being in fight or flight. That's really what that sympathetic state is all about. So by stretching and opening up and releasing the psoas, you're releasing that state of being and allowing better blood flow and less tension going through into your lower back. And a lot of people have manifestation of pain through tight psoas in their lower back. And it also affects kidney function as well, because the kidneys are very close to being pulled forward and being kind of oppressed and suppressed through the tilting of the pelvis. So maybe you'd like to see how one of those psoas stretches works.
Yes, please. It sounds really encouraging to be able to breathe deeply again and to just feel less tight, less tense. Okay, can you show us some self-stretches and some stretches that you normally do at your clinic?
Okay, the first thing we're going to do is we're going to kneel. I will be stretching to begin with. I'll be stretching the right side of my psoas. Remember, the psoas is the only muscle that connects the spine to the leg through the pelvis. So what we're going to do is we're going to place our hand on the hip on the side that we're going to be stretching, which is the right side in this case. The abs are mildly engaged, so we've got a slight posterior tilt on the pelvis, and we're going to come forward. That's my barrier. I can't go any further than that. Now I'm going to squeeze the glutes on the right side. Remember, this is the active, isolated stretching approach to stretching the psoas. So the glutes are engaged. I push through. There is the stretch, and I'm coming back again. So I'm breathing in through the nose first. oxygenating and breathing out as we do the movement, squeezing the glutes and slowly pushing through with my hand, holding it for a couple of seconds and releasing again. So we'll do that one more time, then we're going to add another component to this. There it is. It's not a harsh stretch. It's very much a linear stretch working the psoas major and psoas minor. So now we're going to come in and do this again, but this time as we come to our barrier, we're going to reach the arm up and then we're going to slightly tilt to the opposite side, and you can feel that whole, yeah, exactly, that part of the lumbar spine is getting moved, lengthened. So this is sagittal plane and this is coronal plane. So we've got two planes of motion in action here. Now we're going to add a third plane. So as we come forward again, squeezing the glutes, breathing out, reaching up, this time we're going to add the transitional plane and that rotational plane, and we're going to come across. That's it.
Lower back, right?
Yeah, you're going to get into the side of the lower back. Yeah, up. Well, they call the psoas the deepest of the abdominal muscles, and it really is quite deep there, but maybe you're getting a little of the obliques as well as you go in. Let's try that one more time. Reach, up, blowing out, rotating. That's the transverse plane coming across. 1, 2, and back again. And let's repeat that on the opposite side. So kneeling on the left side, and we're going to feel the stretch through here. Keep nice and upright, slightly extended, breathing in. Coming forward, we should feel the stretch here, pushing through, glutes on, and back again. One side will be tighter than the other depending on how you've been utilizing your body. This is all about finding good mechanics again, rebalancing the left and the right side. Let's try one more of those. Breathing in, glutes on, and then reaching up, leaning slightly to the right side, getting that little stretch through the obliques and the quadratus lumborum. That's good. And back again. In, reach, and tilt. One more of those. In, reach, and tilt. But this time we're going to add a little bit of rotation as well. 1, 2, and back again. Forwards, reach up, tilt, and then rotate. Last one.
I feel less on this side. Is that
normal? That's normal. Yeah, mine is also less on this side. And again. And I would definitely work on the tighter side 3 times more than the looser side. So then we can actually come in and show you how we would do this as an assist. So now we're going to be opening up the psoas with an assisted stretch. That's me assisting Jay here, opening things up. She's going to be using her glute max and her hamstrings to extend the hip, and I'm going to assist her in trying to get a little bit more length, a little bit more opening through this long muscle here that some people call the loin muscle as well. So let's just hold the knee, make sure the knee is open to about 95 degrees. I'm bracing here on the hip. You're engaging your abs, your glutes, and you're going to draw the hip into extension. There is the first point of resistance, and here is the assisted stretch. Remember, it's just 2 pounds of pressure, holding it for 2 seconds, releasing it in between, extend again. So here we go. That's me doing the work now, just taking it past its end of range, couple of seconds, and then releasing again. Let's do that 2 more times. There's the barrier, and here is the stretch. 2 seconds, 1, 2, and release. One more time on that one. Breathe in and breathe out as we're doing the movement. You can see how that's beautifully opened up, which is what I would expect for someone who does a lot of yoga. She's got a marvelous open hip flexor, so no problem there.
So that was an amazing stretch. Thank you so much. My experience of the stretches, I feel actually a little bit like I want to yawn. It's kind of, I always feel like when I'm stretched out, I tend to want to yawn. I don't know if that's normal. Another thing is I noticed I get a lot deeper of a stretch, and I get to angles where I couldn't go to by myself. So that's amazing. Is there anything you would like to add to the psoas?
Well, the psoas is very much associated with lower back pain because of where it sits on the anterior surface of the lumbar spine. And a lot of the time, the psoas is very hypertonic, which means it's very chronically shortened. So it has the ability to tilt the pelvis forward, overarch the lower back, and create a lot of compression again in those lumbar structures, what we call the paraspinals that run along the spine and the lumbar spine area. So those segments become very hard and very fibrous, and we find that a lot also post-pregnancy. After women have given birth, they have been 9 months in this very sort of anteriorly tilted position. You've probably seen that yourself in the yoga practice, but it's one of those things that you really have to rehabilitate. And then most important, the opposite muscle to the psoas is the gluteus maximus, which is one of the most powerful muscles that we have. That needs to be rehabilitated. The reflexes need to be turned back on again, and that works very much with your latissimus dorsi in the lower back. Strengthening and stabilizing those muscles will create a much better balance between the front and back. If you've got too much going on in the anterior aspect of the pelvis, it will mean automatically the lower lumbar spine will be underworking and therefore deficient. So that's where that deficiency comes in.
So I look forward to how to work on those glute max, the buttocks, on our next talk.
Great.
So thank you so much for your time. We'll see you again. Bye bye.
See you soon.